Hi, everybody, and welcome back. I'm Amy Davis, clinical psychologist for Montana Spine and Pain, and this is topic 8 of our persistent pain rehabilitation program, emotion and pain. And so, as always, I would invite you to sit back, relax, get as comfortable as you can in your chair or on your couch, and we will begin this journey together. I hope that if you have questions from last time or from any of the sessions, that you've been keeping track of those and writing them down. Maybe even some of them have been answered by the end of this session today. We'll see. As always, I'm going to share my screen with you, and we are going to begin with our final guided meditation, mindfulness meditation. And this one is a little quieter and a little softer to hear, so make sure that your volume is up. And this will last about 11 minutes long. So I just invite you to sit back and relax and enjoy this meditation for the mindfulness of emotion.
This mindfulness meditation is designed to help you start to become aware of and process emotion in a gradual and gentle way. So take a moment now to find a comfortable position, either sitting or lying down. And you can do the exercise either with your eyes open or eyes closed, whichever feels best for you. If at any point during the meditation you want to stop, simply open your eyes and take a few deep breaths. You can end the exercise at any point. Take a moment now just to take a few deep breaths. Just allowing the body to breathe in and breathe out. And start to become aware of any emotions that might be present for you in this moment. And see if you can label those emotions. They may be pleasant or unpleasant. Just acknowledging whatever emotions might be showing up for you right now. And to start to become aware of where those emotions are showing up for you physiologically in your body. So what sensations you're feeling might be a tightness or a knot in the belly, a heaviness in the chest. It might be a lump in the throat or something else. So taking a moment now just to tune in, observe, notice whatever sensations are arising in your body in this moment. And just breathing into those sensations. Not trying to make anything happen. Not trying to make them go away. Just noticing and breathing. And if it feels okay for you to do this now, bring awareness to the sensation that feels strongest in your body. And imagine drawing an outline around that sensation to help you get a sense of how big it is. A sense of containment, that it isn't your whole body, but just one part of your body that's experiencing this sensation right now, and breathing into the sensation. Does the sensation feel like it's on the surface of the skin, or does it go deeper within? Does it feel dense, heavy, or light and hollow? What is it like, this sensation? Does it feel like it's moving, vibrating, pulsing in some way? Or is it still? If it was a shape or an object, what would it be like? Just noticing, observing like a curious scientist, the sensations in your body, and continuing to breathe into the sensations, not trying to change them, just noticing, seeing if you can allow some room for them to be there. You might not like them, they might not be pleasant, you might not want them to be there, but acknowledging that this is what's showing up in the body right now, allowing the sensations to be fully felt so they can be released and let go. So not trying to make anything happen, but just breathing and noticing and allowing the body to process the emotions and the sensations in its own time. You may like to bring awareness to the breath at the nostrils for a few moments, noticing the air moving in and out through the nostrils. You might also like to bring awareness to the belly, gently rising and falling as the body breathes. Just taking a moment to notice the belly expand as you breathe in and contract again as you breathe out. Rising and falling with each breath. So just taking a moment to rest your attention in the breath. Noticing the breath rise and fall. And knowing that just as our breath will rise and fall, so too do our emotions and the sensations that accompany them. Nothing is permanent in our experience. Everything is temporary, rising and falling away again. Just like waves at the beach, the sensations might come, rise in intensity, rising to a peak, but then will start to drop away and fall back again. Our emotions are just like these waves coming and going. just allowing yourself to breathe into the sensations, breathe into the emotion, knowing that it will at some point it will start to ease and dissipate and fall away, just like the waves in the ocean. Breathing and noticing. And you can continue in this way for as long as it feels right for you. Taking some time to allow the breath to settle. Bringing awareness to the body, sitting or lying. Having a sense of your body grounded. Noticing any sounds that you might hear around you. And very gently allowing yourself to open your eyes if you've had them closed. And bring your awareness back into the room. And if the emotions have felt intense today, just allowing yourself time to do something gentle and soothing now for yourself. Or continuing to notice the breath for a little while, if that feels right for you.
Okay. So just to take a moment, that was 10.5 minutes. What that was like for you, what that was like as a process, how that was for you to connect with the body, connect with where the emotions might live in the body, and what feelings came up. Some of you might make a pretty regular practice of that. Others of you might not. And there'll be kind of varying levels of how easy it is or not to really connect with emotion in the moment, and particularly where it's held in the body. So thank you for doing that experiment. Okay, we're going to share our screen and go back to our PowerPoint here. Because of course, you know, I do have a cartoon for you. I'd like to confront my inner demons, but I'm too non-confrontational. I really love this quote from the wonderful musician Tori Amos. I found the secret to life. I'm okay when everything is not okay. Many times, one of the key presenting concerns that will bring people in to see me for therapy, not just for pain education or to become part of our persistent pain program, is that in some way they don't want to feel how they are feeling. And it's incredibly hard for us as deeply feeling, deeply thinking, sensitive human beings to shut out or block out or stop feeling how we're feeling. It's really, really hard to do. So this invitation is to be curious about our emotional life in a way that perhaps you're already familiar with and perhaps not. And here is one of my absolutely favorite pieces. It should actually say Rumi down here. That little I got cut off. As far as I know, there's not a poet named Rum. It should be Rumi. It's called The Guest House, and I'm going to read it aloud because I think it's so important to be able to just soak these words in, so you can have your eyes open or closed, whatever is good for you. The Guest House. This being human is a guest house. Every morning a new arrival, a joy, a depression, a meanness, some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house empty of its furniture. Still, treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whoever comes, because each has been sent as a guide from beyond. So I share that with you in that it does such a beautiful job of capturing the way that I work with feelings and the way I would invite you to hold compassion for yourself with your emotions. I think we have a lot of painful past conditioning and a lot of judgments about the feelings that we want to have, don't want to have, the ones that are good or bad. And of course, what happens is that they're all just parts of regular human emotional experience. So one of the things that I say a lot to the people I work with regularly is, however you're feeling that way for a reason. It's okay. They're just feelings. We know, and of course this is a review from last time, that strong feelings of all kinds, can be certainly connected to thoughts and behavior. And what we want to be curious about is emotions that are strong and higher levels of emotions associated with distress, because those are the emotions that can also be connected to higher levels of physical pain. And sometimes these are primary mechanisms, strong anxiety, strong trauma-related fear. There's going to be neurotransmitter release from those emotions that can exacerbate pain. Sometimes those are secondary effects, in that if I'm perpetually distressed and anxious, or perpetually sad and depressed, my self-care behavior might change, and that might change my physical health and including my pain. Some of the research indicates that the degree to which we have difficulty regulating or self-soothing emotional reactions, we're likely to have more difficulty regulating pain level. And this statement is not in any way meant to be critical or blaming toward anyone that has difficulty modulating or regulating emotion. Those are skills that we learn, if we're lucky, in our original family. We are taught how to kind of name and notice and have feelings, and that it's okay to have feelings. And we're taught how to self-regulate and self-soothe if everything's been going well. And if that's not the case, we may have difficulty doing that. And again, I think those are absolutely skills and practices that can be learned, and hopefully they're part of any really good therapy relationship and in many other relationships as well. So I don't want any of this to ever sound like, if you have stress, you're making your own pain worse in some sort of blaming way. What we're curious about here is all of the different pieces, mind, body, spirit, that are connected to amplifying pain. And if we go back to the first talk that we had together, pain is a protective output of the brain. So too is anxiety, stress, all the way up to what we would call post-traumatic stress disorder. Obviously, at that point, the stress that we're under is not helpful, and we're not learning anything new from that. But remember, these are protective mechanisms or outputs of the brain. So to then try to say, okay, we want to downregulate the pieces that are not helpful. And these are skills that we can learn. And there are a number of different things that we can do to really work with emotional distress. But again, I don't necessarily want to say any emotional state or any feeling is bad or good for that matter. They're just feelings. Emotional factors that might influence pain specifically, though, alexithymia, which is a lovely Greek word that basically translates to difficulty with discerning and expressing and connecting with the emotional body. Anxiety and depression that are persistent and not well managed. Catastrophizing. Anticipatory anxiety, especially with pain. Fear and avoidance because of pain. So we might in fact increase the level of physical dysfunction, deconditioning of muscles, restricted range of motion, because we are avoiding moving because we're so afraid it will hurt. Not because of the pain itself, but because of the fear and the emotion, okay? Emotional suppression. So not wanting to feel our feelings so much so that we are intentionally blocking them out, moving away from them, avoiding them, distancing, suppressing them, stuffing them. In some cases, if we started doing this early in life as a way to adapting to painful past experiences, we may try to connect with emotions and feel like we're not able to, or we may be numbed or distanced from emotions, okay? And so sometimes that can come out as physiological symptoms, including pain. And then a negative affectivity, or what we would describe as a proneness to be bothered, right? So if we have a temperament that tends to be more irritable and responsive to novelty or to change in a way that is, we perceive that as bothersome, versus, yeah, we can kind of roll with it, and temperamentally we're just a little more mellow. That can also affect how we metabolize and respond to internal stimuli, including pain. Right, so alexithymia is that state of difficulty with identifying and describing and experiencing our own emotional states, and also difficulty inferring the emotional states of others. And there is in fact a scale. There's an article on the relationship between alexithymia and pain intensity. And higher scores on the Toronto alexithymia scale were associated with significantly higher pain intensity and interference ratings. Notice associated with, this is not causal. But a lot of times we can see this developmentally in children, right? As I was working with 10-year-olds in the school system, you know, and 10-year-olds who are dealing with school bullying, maybe divorce at home, difficulty at home, you know, whatever is going on in the life of a 10-year-old. More than likely, when I'm talking with the parents or talking with the kids themselves about what's going on, the 10-year-old is not going to say, you know, it really seems like I'm having existential ennui over my parents' divorce, and I'm not really sure about my own maturational progress as I'm getting ready to go from primary to secondary school, and I'm not sure really where I am with my development of my actualized versus my idealized self. Probably not what kids are going to say. Probably not what most adults would say either. Probably what they're going to say is, I have a headache or my stomach hurts and I'm not going to school. So a lot of times, all of that emotional, cognitive material that we have difficulty identifying, describing, experiencing, connecting with, or we've learned from past experience that talking with others about that is not welcome or not safe. But what can be discussed is the physiological components of pain. I continually have a headache. My whole body hurts. My stomach hurts. Okay. So with uncontrolled anxiety and uncontrolled depression, and I'm not talking about an anxious mood or anxiety in response to one thing, or a depressed mood, I'm talking about clinical disorders that persist and are not being treated. And by the way, there's a number of different ways that we would suggest or be curious about treating anxiety and depression. Certainly, psychotherapy is one of them, but I recognize that's not for everybody. Pharmacotherapy is a way to work with those conditions, but again, that's not necessarily for everyone. Spiritual and religious practices, exercise, meditative practices, social support, all of those are very, very good ways to work with anxiety and depression. Okay, I don't think there's any one right or better way. And it is important, though, and a big emphasis of ours at Montana Spine and Pain, that emotional and mental health is absolutely essential, as is physical health. They work together, they're intertwined. You really can't have health without mental health being part of that. And hopefully, as we're becoming more and more aware of the interaction of mind, body, and spirit, and how health conditions like pain can really fluctuate with those things, hopefully we'll be more open to that. We'll have more and more providers who are skilled in mind-body health, and it will just be more common to talk about mental health and well-being, and there won't be some of the stigma and the shame about it that there can be. Okay, so we know that, again, there are self-contained feedback loops, which might be a nicer way to say a vicious cycle, although it can feel like a vicious cycle. Pain can make anxiety worse, right? Anxiety can make pain much, much worse. Same thing with clinical depression. We can become depressed in response to pain or in response to the functional limitations that we feel are imposed by pain, the losses, the change of role, the change of identity, the change of, the knowledge of who we are as physical beings or as working beings or as partners. And if we had depression prior to pain, the likelihood that our experience of pain could be exacerbated by depression is higher as well. There are some articles for you to read. I know we've talked a lot about the different chemical mechanisms of stress and anxiety and the pain response. Pain catastrophizing, first of all, is extremely common. It is a common human expected response to having pain that persists, especially pain that feels unpredictable, in some way feels unjust, or in some ways feels overwhelming, or all of those. It's so common, in fact, that in page 249 of this blue book, there's the pain catastrophizing scale. And it's often something that I will give to folks that I work with just to kind of see, is that a factor that's happening for them? And what kind of catastrophizing is going on? There's magnification, rumination, and helplessness. Magnification is the belief or the experience of this pain is ruining my life. The size of the pain is so huge, it's blocking everything out. Rumination is the perpetual repetitive nature of the thoughts. I can't stop thinking about the pain, focusing on the pain, worrying about the pain, trying to prevent the pain, trying to treat the pain, avoiding things because of the pain. And even when I feel well, that's worrisome too, because I'm waiting for the pain to come back. That's rumination. And helplessness. There's nothing I can do about this pain. So any kind of catastrophizing that's at significant levels is going to be very strongly associated with treatment outcomes that are poor or less beneficial than we would hope. So that nocebo response that we mentioned. I want to talk a little bit about helplessness in human animals for a moment, because feeling helpless is one of the diagnostic criteria of whether or not someone has post-traumatic stress disorder. So there's the going through whatever the event itself was, whether it happened directly to you or you observed it happening in someone else. There's the fear and the understanding that this is likely life-threatening. But feeling helpless to escape or to do anything about it is also part of what we think happens and what will lead someone to develop post-traumatic stress disorder versus an acute stress response to an event or a disaster in which we did not feel helpless. So self-efficacy and agency are protective factors against developing post-traumatic stress disorder, as opposed to helplessness and feeling as though there was nothing I could do in my situation. Okay, so I want to talk briefly about the learned helplessness studies. Some of the studies involve dogs. The dogs were not permanently harmed. If you don't enjoy hearing research about animals at all, I would just skip over about the next 5 minutes. They were studying learned helplessness in animals to try to figure out learned helplessness in human animals. And so what they did was they had dogs, I think they were shepherds, in cages that had a lever that if the dog flipped the lever, very quickly a door would open and they could get out of there. And they taught the dogs with the treat. It was very quickly learned. And then what they did was they had a noxious stimuli, so like a non-damaging, non-painful, not non-painful, a non-lethal shock administered through the bottom of the cage on the dog toe pads. So of course the dogs felt this aversive stimuli. They had learned they could open the door with a paw, door opens, they're out. Good job, dogs. Then what they did was the lever still moved, but it no longer opened the door. And then they administered the shocks. And you can imagine that what happened was, of course, the dogs went over to the lever and tried to open the door. The door didn't open. And so eventually, in not very many trials, I'm forgetting how many specifically, but it was fairly quick, the dogs exhibited what we have come to understand as typical helplessness endurance behavior in all mammals, just basically hunkering down and waiting for the shock to be over. The learned helplessness piece is when, in those experiments, they re-enabled the lever and the door so that if they had pushed the lever, the door would have opened. They administered the shocks. Most of the time in those trials, what happened is that the dogs didn't try the lever. They simply hunkered down and waited and endured for that to be over. Okay, there's a pretty direct parallel between those learned helplessness studies and when we talk about learned helplessness in humans. Now, it is an understandable, predictable human response to traumatic, unpleasant, threatening, terrifying events. We talked before about the fight or flight response. This is the freeze part of that response. One of the things that we will do in response to threatening, terrifying, overwhelming stimuli, especially if we feel like we can't rescue ourselves, we can't fight, we can't flee out of there, we're going to freeze and we're going to endure it. So if we start feeling that way about our pain, again, that can put us in a really, really tricky place. The thing about learned helplessness, however, is just that it is learned. So a lot of what our program is also about is about finding those pieces, even if they seem small or not as significant at first, where we do begin to feel as though we have some agency. There are things that we can do in response to our pain. But pain catastrophizing, and if it changes our behavior, which it quickly can, is strongly associated with nocebo response. So even the treatments that we would expect to be helpful are less helpful than what we expect, or in fact, they make it worse. Anticipatory anxiety. If I do this, this is going to hurt, right? We become hypervigilant. We become over-focused on somatic information, and we interpret fairly benign somatic information as harmful or as life-threatening, and that becomes the focus of our attention, right? That will increase muscle tension. That's one of the factors that can open those pain gates that we've talked about, and it can become reinforcing. And we can find evidence that we're right. If we're anticipating pain with certain movements and we tense up and we feel pain, the thought might be, see, I was right. I was right. I'm never doing that again. Here's one way to increase anticipatory anxiety. Hopefully you don't have a supervisor like this. The other self-perpetuating loop is the fear and avoidance loop. If it hurts, we will be fearful of moving because we don't want it to hurt again. That is so human. We will therefore avoid the movements that cause the pain to begin with, which will lead to deconditioning of our muscles, our tendons, our ligaments, our tissues. And then when we move, rest assured, we will have more pain. And this can very quickly become that cycle. The way out of this cycle, just to remind you, is pacing and the rule of two. Graded increases in movement, gradually adding more movement, moving underneath that buffer and trying to shrink that buffer so that it is smaller. In other words, so that we can move more before pain comes. There is the Tampa scale of kinesiophobia, also in your book, Fear of Moving. So this could be an interesting thing to see to what extent this is a piece of your pain picture. Again, if you've had really good imaging medical workup, you've been offered that assurance of safety that, you know, within reasonable limits, the pain that you're experiencing when you're walking or when you're moving is painful, but not damaging, not threatening, then what we can begin to do is avoid less, move a bit more, improve our conditioning. This is exactly the way that I think of and work with anxiety, trying to help you avoid your anxious feelings or avoid whatever it is that's making you anxious does not serve you at all, and I won't do it. Instead, gentle approach strategies that allow you to experience your anxiety, begin to have a relationship with it, and know that it's not life-threatening can help that dissipate. Okay. Suppression of emotions. You know, a lot of different people in the field of psychiatry and medicine and psychology have had lots of strong ideas about what happens if we're suppressing emotions, starting with good old Dr. Freud. George Engel is often the one who's credited with the biopsychosocial model, and his work with regard to emotions being linked to physical sensations is pretty important for us. We take those ideas for granted now, but this was fairly revolutionary stuff, at least in the Western world when it first came out. And then a physician called John Sarno is the author of The Divided Mind, and he really talked about what happens if we disavow our anger and our rage, if we disavow our self-care and we are over-functioning and caring exclusively for others. That is going to show up if we've suppressed those emotions, and it's going to show up physically. Pretty interesting stuff. I'd be curious to know what you think of that. Negative affect. Feelings are feelings are feelings are feelings, and I am somewhat hesitant to even assign a value judgment to certain affect. So we'll call these feelings ones that are more likely to exacerbate pain. Anxiety that is persistent and not well worked with. Depression, fear and avoidance, catastrophizing, guilt, shame, and anger. Okay. It usually will increase sensitivity of pain in the body and usually decrease pain tolerance, in part again because of direct chemical primary messengers and effects on the nerves and the spinal cord, but also because of how they change behavior. If I am experiencing catastrophizing over my pain, which is likely if I've had it for a while, if I'm really, really angry about it because I don't feel anyone is helping me or listening to me, and I'm really reluctant to come in and get care, if I'm struggling with depression and my own motivation, but I'm really fearful and terrified of moving and I'm avoiding it, which all of which makes sense. Those are pretty common responses to pain that persists. I'm probably going to have increased sensitivity to pain and decreased pain tolerance. And even with the treatments that I might be offered, they might be working less well because of the fear, the avoidance, the catastrophizing, the guilt, the anger, not because there's anything wrong with the treatments, okay? So how do we reduce the impact of certain emotions on pain? And how do we create a lot of space and a lot of grace to be able to feel the feelings, but not be overwhelmed by them, and also not be fearful of having feelings or rejecting of those feelings? Again, quieting practices, mindfulness meditation, just like the quieting that we did today, where the person leading it basically invited you to just let the waves wash in at the beach and come in and go out, and knowing that all things are transient, all things pass and change. We know this intuitively, and we don't worry about it if the feelings are ones that we've labeled good, right? I have yet to have anybody make an appointment with me and talk to me because they're really concerned that they've been happy too long and they're really worried about it. They don't know why they're happy. They're not sure why they're consistently happy. They don't know what's causing it, and they want help with that. Obviously, that would be silly, right? We hope for happiness or contentment or peacefulness, right? We also know those things come and go and change. Doing the work to diffuse ourselves from our thoughts and our feelings such that we can have those things and observe those things as guests in our house, if you will, without over-identifying with them or taking them on as either true or permanent. Gentle approach strategies towards feelings and emotion rather than avoidance. Avoiding feelings, not going to be successful in the long run. Feelings are part of our life. They're part of our makeup as sensitive human beings. And oftentimes the feelings that are ignored, are suppressed, will grow stronger because there's information there that we need and that we can learn from, and avoidance doesn't usually help. Graded exposure of fear or avoidance where it comes to working with pain and increasing movement, just like pacing and the rule of 2 for physical movement. Helping ourselves decatastrophizing, asking ourselves pretty frequently, am I stuck in some learned helplessness here with this right now? Okay, good. I'm going to see if I can work with that a little bit. Awareness and expression of our emotions in healthy, helpful ways, in ways that are satisfying to us and connecting to others for us, rather than feeling as though if I allow my feelings to emerge into my awareness, I'm never going to be able to get out. I'm going to be stuck. By the way, if regulating of emotion or self-soothing and trauma experiences, if those are difficulties that you're having, and you've not necessarily dived deeply into these things before, those are really, really good pieces of work that can be done with a therapist, with a psychologist, with a counselor, okay? Better done with someone else. We do better learning to regulate and to have self-compassion from someone else, sometimes, oftentimes. Cultivating mindfulness around self-compassion, gratitude for present moment practices, gratitude for the resilience that we do have, gratitude for the things that we are doing well. And then moving toward or inviting or cultivating a positive affect, or what is called equanimity. So when we talk about helpful attitudes in terms of emotion and pain, some of these might seem like really, really difficult to have in context of pain. And I certainly understand that. Acceptance, what I want to talk about is not acceptance of pain as if there's nothing you can do, you just need to accept it. That's more helplessness. Well, I think more about Marshall Linehan's work on radical acceptance. So Marshall Linehan was the creator of dialectical behavioral therapy, which combined self-soothing and emotion regulation with mindfulness, and also really good boundaries and communication with others that were more effective, perhaps, than what somebody learned growing up. And her work is fantastic. And she talks a lot, as do others, about radical acceptance, which means I don't have to like my pain or feel falsely cheerful about it, or say, gosh, what a gift, what a blessing. There can be some toxic positivity in there that absolutely does not ring true for me and that I don't genuinely feel. That's not what we're talking about. Radical acceptance does not describe what I should think or feel about my pain, but it does insist that I confront it, that I deal with it in some way. I accept that this body is having pain right now. I don't like it. It's not a gift for me. It's not an undisguised blessing or any of that, but I'm dealing with it. Okay. Same thing with anxiety or depression. Okay. I would wish that I wasn't feeling anxious right now, but here it is. Anxiety is in the room for me. Okay. And hopefully doing that in a self-compassionate, non-judgmental way. These are phenomenon that we are dealing with, okay? Being able to let go as much as possible of responsibility for things that aren't our responsibility, trying to let go of self-criticism, self-blame. All of this is much more easily said than done sometimes. How to exist with strong feelings and strong physical sensations, including pain, so that we are not constantly in a battle with ourselves. Loving kindness towards ourselves, self-compassion. Gratitude can be a really difficult one to talk about. I don't insist ever that anyone artificially or falsely hold up gratitude for their suffering. That can be really, really unhelpful. But if we are looking at things in our life that are going okay, maybe not even going well, but things that are neutral or okay, are there parts of our lives that we do have gratitude for? Is there part of our resilience in our suffering that we have gratitude for? Do we have gratitude for the fact that we're willing to go out and get help, right? Or to ask for help and support? And if we've been through something really difficult in the past, do we have gratitude that we're not in that anymore? Okay. So gratitude in the more genuine sense of the word, rather than, again, trying to overlay any kind of false toxic positivity on ourselves for, gosh, I'm so grateful for this blessing of pain. If we genuinely feel that way, go with that. If that is not our genuine experience, that's not going to be helpful. And finally, again, impermanence. Thoughts and feelings come and go and change rapidly inside of us. So those are not permanent. Whatever suffering is happening emotionally or physically is also likely not permanent, regardless of spiritual or religious beliefs. In this body, in this carnation, in this time, in this moment, we are impermanent. We will not be here forever. And connecting with that reality and trying to, again, open up the perspective of, okay, how am I traveling in the world? How am I journeying through the world and my life, knowing that I won't be here forever? If you would like more specific information about working with emotion and pain directly, or mood and thought directly, there are a couple of resources for you. One is The Divided Mind by John Sarno. It's a good read. Opening Up, The Healing Power of Expressing Emotion by James Pennebaker. And then finally, Greenberger and Podesky's The Mind Over Mood workbook. This is a more cognitive behavioral therapy workbook that is designed for a self-study for people that really benefit from, specific homework, specific items, how to take something that might be more abstract and put it down into specific bullet points. So just kind of a range of resources there. Well, friends and fellow travelers, as we arrive at the last functional goal planning session of our 8 talks here, I'm curious to know what the functional goals were that you set for yourself 8 sessions ago, how that's going for you. I'm also very curious to know if you've written down and talked about and recorded all of your SIMs, because things happening in your body were the last SIMs, or things that you're experiencing with your physical body were the last SIMs that we were going to talk about. And you've now hopefully collected or shared or talked about or searched for or focused on at least 16 of them, which is more maybe than you were aware of that you had before, and hopefully more. One last cartoon here, and one giant, huge thank you to all of you who are watching this, who are taking notes, who have learned something, who are disagreeing with what we're doing or what we're talking about, but in some way you are open and you are participating. My deep wish is that there's been something, hopefully more than one thing, but that there's been at least 1 or 2 things in this program that are either different for you or made you stop and think, or that you've tried, or that you've learned, or that make you think about things a different way. My hope is that you are holding on to and remembering the importance of pacing and the rule of 2, that you are hearing and remembering self-compassion in your own self-care and in your own self-talk, that if you are reinstating goals for yourself, they're in gentle 5-minute increments, and that most importantly, that you continue to know that all of us here at Montana Spine and Pain are here for you. We are here to help you. That's why we exist. That's why we all collaborate and talk and work together, is for you. And so please know that you can reach out, you can connect with us, you can reconnect with us. If there's anything in these 8 sessions that you think, okay, that was interesting, but how does that apply to me specifically? Those can be really good invitations or reasons to have individual appointments with us that we are hopefully able to do with you. I thank you so much for your time, for your attention, for your participation, for your willingness to do the guided imageries and the meditations. And I hope you go well. I hope that you go well and take very, very good care until I see you again.